Lake Health and Wellbeing is a registered non-governmental organization based in the beautiful Federation of St. Kitts and Nevis. We aim to improve the health and well-being of our local, regional and online communities, and we do that in a number of ways. So we conduct research, we carry out public health interventions, we do some campaigning and advocacy, and we also organize health education events. So non-communicable diseases are probably the biggest challenge that we face globally. The major non-communicable diseases are things like diabetes, hypertension, cancer. All of these conditions are fairly prevalent in St. Kitts and Nevis and in the region. It really does have a huge economic cost as well. The funding that we've received from the Commonwealth Foundation has been wonderful. It has been extremely instrumental in helping us build a strong coalition of non-governmental organizations in St. Kitts and Nevis. And then we've been able to bring all of them together, or work together, really to form a stronger response from civil society around NCDs.
If you want to go fast, go alone. But if you want to go far, go together. We are there for one thing. We need to combat NCDs. We need to reduce the mortality of 74% of deaths in the Caribbean are from NCDs. 40% are premature. 3 out of 10 patients do not know that they have diabetes and they're diabetic. 7 out of 10 hypertensives are not properly managed. That is the reality. So when you think of the statistics, very harrowing, but I don't feel overwhelmed. I feel motivated, but I also know I cannot do it alone.
So the grant has enabled us to build a strong foundation for the NCD Alliance. So it has allowed us to really develop aims and objectives, a strategy, some principles. We've developed the logo, the branding, the website. So all of those things we've been able to do with the grant. But also we've been able to start to build the capacity of our NGOs. And so we've had various different workshops and webinars on various different topics that NGOs said were important to them and that they needed training on.
Well, diabetes and hypertension are the bedrock of NCDs. Of course, obesity, you can't live without that. And our country has transitioned from a primary agrarian society. We are now mechanized, everybody drive, and we are eating out of refined food. What we go is being thrown aside and we purchase stuff that are imported that are highly processed and high salt, high sugar content, highly refined food, low in fiber content. These, to me, are part of the genesis of epidemic of chronic non-communicable diseases.
And we've also been able to, through the Alliance, engage with key stakeholders like the Ministry of Health. And we're really happy to be able to engage with the Prime Minister's office on a workshop.
This week is being celebrated as the Global Week of Action on Non-Communicable Diseases, NCDs, with the theme Bridging the Care Gap.
The Ministry of Health has enjoyed successful partnership with a number of the members within the SK and NCD Alliance. For example, the Diabetes Association. We've been working with them for a number of years now with their outreach sessions for health screenings. And then we've also enjoyed partnership with Lake Health and Wellbeing, who has been very instrumental in working with the Ministry of Health, especially on our sugar-sweetened beverage policy. They have a very successful campaign called You're Sweet Enough. And because of this collaboration, we know that the public has gained a lot of information as it pertains to sugar-sweetened beverages and the harmful use of these beverages to their health. The SKN NCD Alliance is actually poised very well to play a pivotal role in that area. By continuing their advocacy and community engagement, they can ensure that NCD prevention and control can remain a central part of our health system planning.
To treat and really truly understand non-communicable diseases is an expensive affair. And so I think we do need a lot more funding to really tackle a lot of these issues.
I certainly think if we begin to collaborate immediately, the work that we'll do in terms of for the unforeseeable future has to start with collaboration and cohesion.
We just want to continue. We want to ensure that we can grow the Alliance. We have big ideas, but obviously it is always the resources that kind of curb us a little bit and inhibit us from doing the work that we would like to do. So grants like this are so important. Without these types of grants, we just wouldn't be able to do the work that we do and have the impact that we're having right now. So we're very grateful for this opportunity.